Good morning, everybody. The time is 9:46 a.m. I would like to call to order this meeting of the Alameda County Lead Poisoning Prevention Program's Joint Powers Authority for today, May 25th, 2023. We are situated here at Emeryville City Hall, located at 1333 Park Avenue in sunny Emeryville, California. Or you may join us via Zoom using the link or phone number provided for on the top of today's agenda. I will ask if the board secretary please call the roll.
Director Hardy? Here. Director Miley? Director Bella? Here. Director Winra? Director Gallo?
Present.
Director Bowders?
Here.
Mr. Chair, you have a quorum.
Thank you, Lisa. Now is the time for public comment. Directors, alternate staff members of the public who wish to comment for an item not on today's agenda will have 2 minutes to do so. Did we receive any written comment in advance of this meeting?
No public comment.
And I see, I don't have the screen up, so you'll tell me if there's any hands today, but I have no person here speaking to speak at public comment, so it's closed. That'll move us to item 3, which is our consent items. We have meeting minutes from April 27th, 2023. Are there any comments on the minutes? Seeing none, is there any public comment on the minutes?
No public comment.
Public comment is closed. Is there discussion? Seeing none, is there a motion?
So moved.
Second.
Thank you. We have a motion by Gaia and a second by Bella to approve the consent calendar. Please call the roll.
Director Hardy?
Aye.
Hardy, aye. Director Miley? Director Bella?
Aye.
Bella, aye. Director Winra? Director Bowders?
Aye.
Bowders, aye. Director Gallo?
Aye.
Gallo, aye.
Thank you. That motion passes. We'll move to item 4, which is the goals and objectives for fiscal year 23-24.
Good morning, directors. This is an action item. You've received copies of our goals and objectives, but before answering any questions or any comments, I would like to highlight one item in the goals and objectives. It's found on page 9. For anyone who doesn't have a copy of this, I'll just read it out loud. And it is to train 150 individuals, including property owners, property managers, renovators, maintenance workers, partner staff, and residents in lead safety skills and lead in helping housing principles by June 30th of 2024. It goes on to say that we will provide healthy homes or lead safety training. To that end, I would like to mention that we brought this up at the last JPA meeting. We were going to be providing some training to code enforcement officers and building inspectors as part of meeting the goals. This training will include in it something unique because typically the EPA renovation repair training is an 8-hour training. But we've actually added a 9th hour to it. There's actually a lunchtime presentation that will be done by a code enforcement officer that will focus on California regulations and how to approach lead issues from an inspection standpoint. This is something that we added with the blessings of the EPA as a result of what we learned through the pilot project we did back in 2018 for the EPA. We discovered building inspectors and code enforcement officers are much more responsive to complaints about contractors and painters creating lead hazards when they've gone through that extra hour of training that focuses on their powers and their authority to address unsafe work practices. Trainings have been scheduled in Oakland for June, and space will be available for other jurisdictions inspectors to attend. A meeting is scheduled Friday with the chief building official of the city of Berkeley to discuss a training in Berkeley. And we have reached out to our contacts in the cities of Alameda and Emeryville, as well as other Alameda County cities to put this on. The department did receive that grant from the EPA to hold some regional trainings. We are actually going to be focusing on, again, doing those presentations with the EPA's funding, including this code enforcement presentation, and that will be in August. Additional trainings are also planned to ensure that code enforcement officers and building inspectors throughout Alameda County will have this opportunity to be trained. So if there are any questions or comments about that particular goal and objective, or if there are any questions, comments about other goals and objectives, we're available to answer those.
Okay, thank you. First, is there any public comment on item 4?
No public
Okay,
comment?
public comments closed. Directors, recognize Director Gaio.
Yes, so Mr. Brooks, so the training in Oakland is gonna happen when?
We're planning that for June. We've already been talking to Tim Lowe and David Miles. All of their.
Guys, April, is that microphone on?
It is, I tested it earlier, let me
Just maybe pull it, just straighten it up towards you, because I just want to make sure it's being recorded.
Testing, can you hear?
It just seems really low.
Nope.
sorry about
Thank you. Okay.
So we have been speaking to Tim Lowe, David Miles, some of the other members of Building and Planning Department. The intent is at their request to have all of their building inspectors and code enforcement officers to receive the EPA lead safe work practices, also known as renovation, repair, painting rule training. But it'll be spread out because we recognize that they can't all take that now 9-hour training at once. So there'll be several classes offered because we recognize that they have field work to do, and so we can't take them all out of the field at one time.
So this is directed at city staff,
City staff,
planning department?
code enforcement, building inspection, not necessarily planning. And other cities will also, their building inspectors and code enforcement officers are also being invited to those trainings.
And you'll provide us the exact date and the location of the training?
Yes, we will.
Okay. Thank you. Director Bella.
You mentioned that the other cities are also being invited and that it's gonna be multiple days now, multiple days in June or just starting in June?
Starting in June, and then there'll be some other trainings taking place in August. Location to be determined. We believe it'll be in Berkeley, but we will be offering trainings for quite some time because we want to ensure that all the county's cities have the opportunity to send their code enforcement officers and building inspectors to that training.
And will we be getting a report back after the training as to who attended and who else? I think what would be helpful for the June meeting is just even getting a tentative report back of who's gonna be participating. That way we have time. Do they have to start in June in order to be there in August, or is the August gonna be just a new?
That'll be another training, yeah. Under the EPA guidelines, we're only allowed to train 20 participants at a time per instructor. Now, we've been known to bring in a couple of additional instructors so that we could train like 40 to 60 people, but right now the intent is to offer at least 20 participants per class, and that's going to be done for quite some time because we also understand that under Senate Bill 1076 that went into law last year, that the state is going to take over the enforcement responsibilities from the feds for the renovation, repair, painting rules. So the intent of that bill is actually to ensure that going forward, all code enforcement officers and building inspectors throughout California will get that training, and that every 5 years they'll go through a refresher course.
Will this training be available by Zoom also, or it's gonna be live?
The intent is live. There have been some opportunities, I know, during the pandemic to do webinars where they were able to do the training, but the intent here is to do it live. Because one important aspect of the training, of the 8-hour training, is some actual practical hands-on training where they actually get to do some of the types of work, putting up containment, things of that nature, that contractors and painters are expected to do when they're doing any type of renovation repair work. And we've heard from the code enforcement officers that they really appreciate that practical training and, wearing proper safety equipment, PPE, because it helps them in terms of, again, when they're out in the field and they're responding to a complaint about a contractor creating lead hazards, they know exactly what they're supposed to be doing. Because sometimes you get pushback from the contractors and painters. You know, they'll say, who are you to tell me I'm a painter, I'm a contractor? Code enforcement officers can say, you know, we've been certified in RRP and we know what you're supposed to be doing and you're not doing it.
Thank you. My only ask is, you mentioned you're gonna do it, but we have in Emeryville now, we're a real city. We actually have a code enforcement officer as of about 30 days ago. So we'd just love to save one seat at one of these trainings for Nicole Ewing, who's our new code enforcement officer, so that she has the same access to the training that all the good people in Oakland and Alameda will be getting.
It just so happens after last month's JPA meeting, I went down there to your building inspection department, introduced myself, and left emails inviting Nicole to come to the RRP training, and also reminding Victor it may be time for his refresher course, and so we'll be offering refresher courses as well.
Great. Anyone else have questions or comments on this item? Director Bell?
Yeah, I think if we could just get the report back in June and just have it be it's part of the standing director's report, that would be helpful, just to make sure that we're on top of it and getting the outreach out to all of our city staff to make sure that they attend and remind them that they might have gotten the training 5 years ago, but they need to get it again, do the refresher. Thank you.
Okay, we can do that, thank you.
Director Guy?
Just the last one. So in case someone in Oakland cannot attend the open training session, are they allowed to maybe join the Emeryville or the Elmhurst?
Or Berkeley, yes,
Okay.
yes,
So you'll give us all the dates and stuff.
that's correct.
Okay, in case Ladis takes over my job and I become an inspector. I want to go to your training.
So are there other questions about any of the other objectives? This is an action item to approve them for fiscal year 23-24. There's no additional questions. I'll entertain a motion to approve.
So moved.
There's more to present?
There's one more presentation.
Well, what's the motion? Well, we're already approving you, but come on up.
We have our health team manager, Katie, here to discuss a portion of the goals and objectives.
Okay.
Good morning, directors. My name is Katie. I serve as a CLIP coordinator with Healthy Homes Department. So I'm just going to I know you all have read through it, so I'm not going to read it off to you, but I'm going to go over some highlights from CDPH objectives and deliverables. So a lot of it hasn't changed. We're really building on the foundation from our last fiscal year, but with the new change, we're tackling a lot of kids with 3.5 and above. That's the new reference range for the CDC. It's going to capture a lot more kids. But in order to kind of capture kids that fall through the cracks, such as undocumented children, refugees, and that of that nature, we have other objectives framed to match those deliverables. One thing I wanted to highlight is we're noticing that we're missing a lot of screenings and a lot of kids are falling through because pediatricians are not aware of the health codes and certain regulations that are mandated by the state. There's also a lot of preconceived notions about publicly and privately insured kids, and those privately insured kids are missing those screenings that are actually mandated by the state. So CLIP is aiming to actually frame a targeted provider outreach campaign. We're going to start with focusing on 4 provider offices. These will specifically target, of course, all of our CSA cities, but then of course also looking at high priority and high risk neighborhoods and unincorporated areas. In these targeted outreach campaigns, we're looking to provide providers and their staff education about service delivery gaps and gaps in education on what those regulations and codes are and how we can kind of improve those screening rates. Additionally, we're also kind of looking to expand in other public entities like school systems and whatnot for those who don't have medical homes. And then a way that we're kind of looking to capture those undocumented individuals, as a lot of our lead poisoned children are undocumented or aren't eligible for public health insurance programs, we're going to be doing tailored educational workshops specifically at refugee centers or clinics that have those high volume of populations. One way that Alameda is going to tackle this is going to start with Alameda Health Consortium. These include 8 federally qualified health centers that will have a high volume of these children that we wouldn't be able to get in a public school system, we wouldn't be able to capture from a medical home. So we want to start off with our finalized copy of our goals and objectives, starting off with 2 workshops at one of the 8 major FHQs in the area, although we would really like to expand that to at least 4, so we can really kind of cover a lot more ground, but it really just depends on kind of what we're able to do and who has the buy-in and how we can create that political will. And other than that, other CDPH deliverables that don't necessarily directly relate to health, we also are going to really revamp our proactive inspections. We've had a criteria with lead hazard control units before, but we're really looking to kind of build that process and looking to explore other areas such as home-based childcares and doing proactive inspections in areas like that, and seeing how we can kind of get more units in some of our programs. And then kind of working, and then the last thing I wanted to really touch on is, of course, enforcement and compliance is always an issue, especially when we have delayed remediation or improper remediation efforts done. So we're really looking to kind of create new MOUs and do new partnerships with the DA office to see how we can implement a formalized referral program, and also implementing some other interdisciplinary work groups in our department, so how we can kind of really pair health and housing to have a better kind of timeline and regulations for meeting our compliance. So that's pretty much all I have on CDPH end of things. So that's all I have for today. Open to questions before you guys close. If you have
Thank you. Any questions? I have a couple questions on this.
Sure.
So the children who are missing screenings, is lead screening part of EPSDT?
EPS.
Early periodic screening, diagnostic and testing, federal government Medi-Cal program?
It is, yes.
So children who are in Medi-Cal?
Yes, Medi-Cal is not an issue. It's a lot of kids who aren't in Medi-Cal program because Medi-Cal regulations are very stringently communicated to providers. But the problem is that there are actually a lot of non-Medi-Cal children that are missing those screenings because the regulations aren't as well known for those. So that is one of the big issues.
Okay, so, all right. Okay. I'm just thinking through, I mean, you're proposing a practical solution to the problem. In my professional workspace, we had the same issue with trauma. Like children who are exposed to trauma very early have ACEs, right? And those childhood experiences, there was no screenings for that. We're having a lot of children who wind up in very bad situations, juvenile delinquency, other types of child-based care that are not really care, mostly because they were exposed to violence in their communities, exposed to the foster care system in a negative way. Different challenges, and I ran legislation through with some members of the assembly a few years ago to actually add periodicity screenings for all providers to do trauma screenings, and it did require providing a new Z code, as they call it, for the private insurance companies to actually get reimbursed by the state in order to do it. Otherwise, they wouldn't do it, right? Because it's not on a mandated schedule for them.
Right.
So just thinking, like, how do we compel private insurance providers to do this type of testing for children 0 through 6, which I know is the primary target zone, right?
Right.
In order to ensure that we're proactively catching kids who have lead poisoning early. So can you just maybe talk a little more about like what your ideas are for how to capture kids who are not in Medi-Cal that aren't seeing doctors that know to do this?
So in terms of, we'll be looking at, we're working on collecting data to kind of get the demographics situated in terms of see, what kinds of kids are in a lot of those provider offices, which ones are providing those universal screenings versus which ones are just providing those targeted screenings. One of the things that we're going to include in our curriculum is that the state actually does have mandates and actually written in their health code and regulations for both public insured kids and privately insured kids. So there's already actually mandates written in state health codes that are also that are set by CDPH. So that's going to be one of the things that's included in our curriculum. But in terms of the the documentation of terms of how those screenings are embedded and implemented and the flow of that provider office. That's something that we would have to talk to them about, what their internal processes are in terms of coding and billing for certain screenings, and other kinds of screenings that they do, whether they're mandated or not. So we would have to find out more about the internal process of those provider offices that we're looking at in terms of how they already have some of those screenings in place, especially when we're kind of like you said, shifting a lot of our care towards trauma-informed care. We want to see how we can kind of loop lead screenings into those trauma-informed models, especially with ACEs having been a new, having come about and really being kind of included in a lot of more provider approaches and whatnot. So we really would we're going to include a lot of what's required by the state, and then how to kind of embed those requirements in the internal processes of those provider offices. And then we'll also kind of take a look at the capacity of provider offices. There's a lot of gaps in education and knowledge, and that's kind of the place that we want to start. So we really would like to kind of make sure providers know, what's required versus what's recommended, versus what's required in terms of invasive things like getting a venous blood test versus what they can do in terms of funding for point of care testing. We also want to kind of look at, some of the regulations state a screening is required, but not necessarily a test. And by screening, it's a series of questions. So then it comes down to, like, we look at, the theory of least invasive to most invasive. How we kind of break it down to, have a very simple process in place to capture more kids that may take less resources. So it's kind of looking at it from a lot of different angles, providing education and filling in the gaps of education in terms of health and code regulations set by CDPH, looking at the provider internal processes, how we can kind of work with them to implement very simple processes that wouldn't change the flow of their office or their work that much, especially when there's a lack of resources, and potentially looking at other community organizations or CBOs that we could partner with to support provider offices, such as labs or mobile testing centers, that we could potentially maybe look at programs that could do free testing, or we could have standing orders. So there's a lot of different avenues to tackle this, and there's a lot of different ways that we can go about it, but those are some of the places that we would like to start. I know the answer was a bit convoluted, so I was a little bit around that.
I followed it very well. I
Yeah.
appreciate the answer. In 2017, the bill was Assembly Bill 344, that did trauma screenings for children. And it's just as you noted, the Department of Healthcare Services, right, so not DPH, but DHCS, created a statewide work group. I chaired the work group, and it had mostly providers and people from insurance companies and other medical field professionals who engage as primary providers for children. We basically engaged in a year-long process for identifying and developing a screening tool that was the least invasive but most effective, right, in terms of being able to get providers to, with their 10-minute billable periods, to know I could ask these 12 questions of a parent, of a caregiver of a child, and be able to identify whether I need to ask the next 10 questions, because the 12 questions, 3 of them were yes, and that puts the child into a likely scenario of being exposed to ACEs. And then basically taking the outcome of that screening tool, adopting it, having DHCS formally adopt it, and then having it be part of state mandated training to all providers as part of their annual, certifications to retain licenses. So I think some of the things you said are good. It will need to be broader than Alameda County to do that, right? Like, you'll need to partner with others, but there's definitely a path to doing that. I personally, just as somebody who professionally works on wellness for children, feel very strongly that screening is the most effective way to mitigating harm in children, and that's a huge gap that we have in the healthcare system, with providers prioritizing what a person comes in and asks for, as opposed to kind of knowing what the global risks to children are, and then many parents don't understand what ACEs are or what lead poisoning is, so they don't think to ask for that. They come saying, well, Bobby has the flu. That's great, but while Bobby's here, we should also use the opportunity to identify, are there other things that you should be looking for? And there are some people in the health profession who say, oh, you're like looking to diagnose children with problems, but the reality is, like, children don't know how to self-report these things in ways that lead us straight to the problem, right? So screening kids is a really important way of mitigating future health problems for them. And I just think that to the extent that the county can be a leader in that, or to the extent that we want to, lean in and at the, at a future meeting, if the part of the program is the board was to write a letter to the county DPH and say, we really want you to, engage in XYZ practices with providers in a way that we think will better educate, which I think is the key here, better educate and inform that service group in a way that serves our children across the county, because it's mostly going to be kids in East Oakland who are the most at risk and the least likely to have, if they're not on Medi-Cal, the least likely to have a provider who's saying, yes, let me proactively screen you to make sure that you're a healthy child. So those kinds of gaps, that's an equity issue in my opinion. So thank you for that. Are there others who have questions for Director Guile?
Yes, can you provide us a list of organizations that you will be working with, already have in mind, and also the timeline?
Of course. So in Alameda Health Consortium, there's actually several federally qualified health centers that we want to start with. There's 8 that we want to look at. We're basically going to potentially set up meetings with all of them to kind of really hone in on the demographics and the breakdown of the volume of which they serve, to actually find out, who would be at highest risk or have the most volume of high-risk clients. Those would include Asian Health Services, Access Community Health, Bay Area Community Health, La Clinica, Lifelong Medical Care, Native American Health Center, Tiburcio Vasquez Health Center, and West Oakland Health. So those are the 8 that we want to start with. Of course, we're going to be looking to branch out beyond those. But again, those are the places we want to start. Additionally, we're working with some of them already in terms of previous outreach efforts and projects, but those are the first few that we want to name to at least start with in the FHQ area.
Have you looked at the educational institutions at the high school level? They also have a health program.
Yeah.
Like Castleman Freeman, and they have a high population of youngsters that are being impacted.
Yeah, and those are also definitely places that we want to explore. The other really untapped entity, in my opinion, is really looking at the Office of Education and public school systems. The thing is, public school systems are huge in terms of capturing kids that don't have medical homes. There's going to be so many kids that don't have that, and you're going to miss them inevitably. The first place you want to start is looking at school nurses and their staff in terms of course, they're all overburdened and overloaded, but again, when we kind of look at how can we implement a small process that can have a much greater impact. So that would start by looking at the registries they have access to. School nurses have access to immunization registries. Why couldn't we give them, or at least help facilitate access for them to have access to our surveillance system? They could potentially be doing lead poison screenings for kids that we wouldn't capture anywhere else. Additionally, there are states all across our country that have legislation. This is also going to be generating political will with our department. There's a lot of states that have it right where we have school registration requirements that require lead poisoning screening, regardless of their age, regardless of what the state mandates are. To my knowledge, we don't have anything like that in California. There's no school registration requirements that involve lead poisoning, aside from those that are set by CDPH for 12 months, 24 months, and so on and so forth for refugees.
And I can help you with that. You have a captive parent body.
Yeah, no, that's, I would love to.
Principal calls you, you're all gonna show up. So
Yeah.
anyways, thank you.
Of course, yeah.
I would,
Further than you can.
I think that there's a couple things that I would recommend on the education front. I think certainly in Oakland, there's more community schools in the city of Oakland than anywhere else, and those have school site councils. But I also want to express a little bit of a concern around requesting school nurses to use information that is, there are a lot of privacy laws around the information that they have access to. So there does need to be a certain degree of informed consent if we're asking them to engage in some sort of review or things like that. So there will be questions coming from school nurses. They are certificated staff, so they also have to adhere to a number of different regulations at the school site. and then adhere to the different privacy standards. So there's a lot of informed consent, if we're gonna be, utilizing the documentation that they have to look for other things. So I just wanna flag that as a potential issue. I know in other states, they've addressed it through actual state law, that would give that authorization and include it in a blanket notice to the parents that is, by participating in the program, those are certain things that the school nurses would be looking at. So just want to flag those things. I do think it would probably be helpful for you to meet with somebody like Erin Ross, who's the state, she's part of the state Department of Education, Office of Health Services. I'm happy to put you in touch with her. She worked as a certificated school nurse for over a decade. And is now advising the CDE as to health issues and initiatives. I think the other thing is that on the education side, a lot of the, Director Bowder has mentioned this, it's not so much the students that are in the Medi-Cal system because they've already been screened, there are certain requirements for them, but it's when they enter the system, and so a school nurse may or may not know when that has happened. So I think that finding ways for the system, and we often focus on this, is like, how do we get our systems to actually talk to each other so that you have more kind of seamless care, so that people aren't having to re-register or transfer information over or get retested. I think what we would also hate to see is a student that has maybe been Medi-Cal eligible at one point, not Medi-Cal eligible, and then again Medi-Cal eligible, getting retested unnecessarily. That's going to upset people. So just trying to figure out those sorts of situations while also getting the word out about why testing is important and should be something that school nurses are thinking about or looking at. But I think Erin would be a good contact for you, and then also maybe talking with the community schools folks, just because, like I said, they have different school site councils, and that's really where we're trying to bring the different school-based health and have on-site programs. So happy to make those connections as well.
Thank you so much.
Appreciate the proactive approach.
Thank you, Director Hardy.
I just want to ask, are you finding that the doctors and physicians are more accepting of adding these lead tests, to their examinations? I ask that because as a member of People United for a Better Oakland Pueblo, we were the instrumental organization that worked on lead poisoning, and why we now have this board to be able to do some of the things that needed to be done and things that have been done, and add additional things that have been added to the program. But we initially, when we worked on this issue, wanted to make sure that our children were being tested. I am a mother, a grandmother, a great-grandmother, and a great-great-grandmother. And I know that when my oldest daughter was tested, they only wrote on the information that I received was negative. And, it's like, now that I have been working on this and been part of this, and I think back, because now this particular board has been a part of since like 1992, 93.
Yeah, 91, 92.
Yeah. And we worked on the issue a long time. And here in Oakland back in 1988, they did a lot of testing of lead in children here, but that was all they did, because otherwise the parents didn't really know, because you weren't given the information. And as I mentioned, that my daughter, who is now 60, was tested and they just wrote negative. And like being a part of this and working on this lead issue at the time, I started thinking and saying like, well, what exactly does negative mean? Right. Of course, I realized that there have been a lot of changes and a lot of things, whereas that there have been acceptable numbers. I can't remember now, I'm getting kind of old forgetting stuff, but there was acceptable numbers of levels that were acceptable, and the number has gotten smaller. But I would like to see the number get even smaller and zero.
No, you bring up a really good point, and that's one of the biggest reasons why we're looking to do a targeted provider outreach. even anecdotally, when I've been contacting a lot of provider offices individually and gathering information and anecdotal evidence from my staff in terms of how these communications have gone, it really is a mixed bag, to be honest, to answer your question. There are a lot of providers, there's a group of providers that just don't have the knowledge, there's a gap in that knowledge. So a lot of times they have that buy-in when we provide them that knowledge and talk to them about the regulations and the importance of testing in general, both universal and targeted screenings. A lot of them will start implementing in their practice. There are some providers that really focus more on kids at more risk, at higher risk, like those living in at-risk properties pre-1978 or other families who are new immigrants or refugees, which would be higher risk for non-housing sources and whatnot. But then we also, I think one of the biggest concerns I have is a lot of providers. There's been actually a handful of providers that I've contacted who don't believe lead is an issue anymore, that it was back in the 70s and 80s and it's no longer an issue. And they are not providing those screenings. And I think the biggest concern out of that pool is there's actually been, we've been hearing a lot of, I actually met with the Head Start Health Advisory Committee board meeting last week, and we were hearing a lot of stories from parents that they're asking their provider for lead screenings as parents are learning more about it, and providers are pushing back and saying, oh, no, they don't need that or they don't need this. So that is a huge concern where we're finding that a lot of providers, parents are advocating for it, and it's clearly in very strong recommendations by CDPH that if parents ask for and advocate for a lead screening, providers are supposed to provide that. Unfortunately, a lot of them are missing the mark on that. Now, it's not many, I would say, majority of providers that we work with are providing screenings, especially they're buying in as we provide the education, even if they were ignorant to it or didn't know about what we should be doing. But so those are the providers that we kind of want to target the most. And I think the other end of this is that we would really like to be doing a lot of outreach events to work on advocacy efforts. We want to provide parents with advocacy toolkits because when a lot of parents get pushback from providers like they don't need that, we'd really like to provide them toolkits for how to know what your rights are as the case and what your rights are as the parent, what the child actually needs, and what the provider is required to do in their scope of work and within regulations of the state. So it's a mixed bag to answer your question, but.
I just want to add one more thing because I know and I realize that a lot of these houses, especially here in Oakland, as well as Alameda and some others, they have these very old Victorians. A lot of people are buying into them and they're renovating and painting, and they don't realize, like that, not until, I believe 1988, 87, 88, that lead was, was not to be used like, in paint. But a lot of these old houses still have, those lead layers. And when you have small children, and especially you have children that are toddlers, they be sucking on the windowsills, and so eventually they bite into, maybe you might not believe that, but kids do that, because they don't know any better. The first thing they do, even if they touch lead dust and anything else, they put their hands in their mouth, so, excuse me.
Yeah, no, it's huge. It's definitely one of the biggest things that we look at with a lot of our programs. So you're absolutely right. Yeah.
Okay, are there further comments or questions? Director Bell?
And I think also because of the pandemic, when everything was telehealth and remote, it was a lot harder because I was one of those parents who had the 1-year-old and the 2-year-old during the pandemic, and I got you don't want to bring your child into a facility right now because of the pandemic, and they don't have on-site blood collection for a lot of private providers. So I do think that there needs to be, I like the idea of a toolkit or just kind of here's the benefit, like worst case scenario, it's just a test. The test could come back and say there's nothing wrong. But I think there's a convenience factor that's like the big thing that I think we also have to think about is how convenient is it or inconvenient is it? Because if you've got a little kid and we're asking people to kind of come in a second time or to go to another place, if you don't have the privilege and, the economic privilege of being able to kind of have somebody watch your kid, or, you can take off work and you can, get around easily, those are barriers, and they're real for a lot of people.
No, you're absolutely right.
Okay, well, there's a motion by Gaio and a second by Bella to approve the objectives for fiscal year 23-24. Please call the roll.
Director Hardy?
Aye.
Hardy, aye. Director Miley? Director Bella?
Aye.
Bella, aye. Director Winrow? Director Gaio?
Aye.
Gaio, aye. Director Bowders?
Aye.
Bowders, aye.
Thank you, the motion passes, the goals and objectives are approved. Thank you for your presentation and all the answers to the questions. Move to agenda item 5, which is the budget for fiscal year 23-24.
And to present the budget is April Williams.
Thank you, Mr. Brooks. Good morning.
Good morning, April.
Okay, I'll be speaking to the, gosh. Line of sight.
Watching you.
I'll be presenting today from page 14 in your packets, the summary of changes I will go over, but I'm open to any specific questions on the detailed budget with the previous 2 pages if we need to go there too. Okay, I want to start with the change in the budget for DPH, as Katie was just reviewing. It went from the last contract cycle of $993K to a little over $1.7 million. While we're very happy for that increase, as always, to have our budget increase, what has also happened is that the scope of work increased, not necessarily in proportion to the work. And what I wanted to highlight for that item was to let the board know that there have been quite, what would you call them, spirited discussions, Larry, statewide from local jurisdictions back to DPH regarding the increase in scope of work because they don't feel it was commensurate with the number of dollars that were provided. And this is mainly in the area of compliance. They're asking many of the clips to do more work proactively, which we have been, our particular jurisdiction has been doing all along. But for some of the smaller jurisdictions, other jurisdictions, they're asking PHNs to go out and talk to, building departments and whatnot, and that's kind of outside of their realm of understanding. But from the state's perspective, this is something that is part of the lead poisoning and prevention work, so that can be included in the contract. But I believe, Larry, is it the California
Health Officers Association.
California Health Officers Association has taken the lead in trying to advocate for the clips to be able to get more money from DPH to provide these services. So that is, we've given them some data about like how much we think it would cost to do everything that's in the contract, and we've given them those numbers, and they're good $500,000 for our jurisdiction. So hopefully we can come to some agreement about maybe they can come down and we can come up and we can meet somewhere in the middle. So that's what I wanted to highlight that, because it looked like a big number, but I didn't want to, the board to think that we were throwing money in the air. There's still a lot of work to be done with not enough money. But I wanted to pause there if anybody had any questions before I go on.
All right, you can go on, we'll just take the whole thing and then we'll do one.
Okay, very good. Okay, taking a look at HUD lead hazard control, there's a slight increase in that line item. That is the remainder of our grant that is scheduled to end in July, but we requested an extension. We're hoping for a year, but if we can get 9 months to do the remainder of that work, we'd be happy with that, but that was relevant on that increase. The other thing I wanted to point out was CDBG minor home repair. There's almost a 30% increase from the current fiscal year to next year, and that represents rollover from this year. There were additional funds and we get to roll them over so that we can spend them in the jurisdictions in the current year. The other line item I wanted to highlight was the lead settlement funding. We have decreased that lead settlement funding this year, which is we're able to utilize other funding sources. As Larry mentioned, we got some EPA money. I've already noticed some DPH money, and so we're doing our best to try to preserve that money to make it last as long as possible. So if we don't need it for salary or other discretionary expenses, then we will use those funds first. But let me pause at revenue, or did you want to just keep going?
No, that's okay, we'll stop now for questions on revenue. Are there revenue questions the members have? I had a couple of quick questions. So the lead hazard settlement fund, the grant, the HUD lead hazard control grant.
Yes.
That grant, we're seeking an extension, but how many more years are left on that grant, or is it done at the end of this coming fiscal year?
It's done, it's like July 3rd or something like that, it's done. And then, so we're considering an extension, it's a no-cost extension. And so we'll have to use some other funding to cover staff costs, not program costs, to finish that work.
Okay, is there gonna be another call for grants to get another grant, or are we gonna compete in the next coming year?
Yes, we actually are working to complete the next HUD grant cycle that we're gonna submit, the beginning of June for another cycle, yes.
Okay, my other question was about the lead settlement funding. Can you remind us, when we have to spend the funding by? Did that remain part of the settlement? I believe there was a term that was debated about, we
Right,
didn't spend all of it by a certain time, went back to the paint companies.
yes, no, there's no dedeadline on this.
There's no
In
deadline.
the settlement, there was no deadline. We've just projected for our particular jurisdiction, 5 to 7 years.
Okay, great. Those are my questions. Anyone else with revenue questions?
Okay,
Director Guy.
Yeah,
Okay,
just,
sure.
just for the public's information, can you just read for the record in terms of your total revenue changes from 23 to 24? And,
Oh, just read them out.
yeah, just
Oh,
for the
sure,
public to know that these are the numbers we're talking.
Oh, sure. For CSA, there's a slight decrease of 3,568, that's just due to the houses being demolished. We can't recreate the 1978 housing, so those go down very tiny each year. An increase in a CDPH funding of 750,974. HUD letters of control, an increase from last year of 172,97. DPA remains the same and steady. CDBG, minor home repair is up by 37,948. And a decrease in lead settlement funding of 427,592 for the reasons that I've mentioned.
So we have a balanced budget for the next
Yes,
coming years, right?
Yes, we do.
Okay.
Yes, we do.
All right, thank you.
Okay,
You want to cover revenues briefly?
I will cover expenses briefly.
Or, sorry, your expenses briefly.
Yes, sir. Okay, so looking at, just want to highlight in discretionary, that drop in discretionary of 309,720 is mainly from the settlement expenditures. That we were looking at some of the work that we were doing and just adjusting. That was, last year was our first year of lead settlement, so it was kind of like leveling off of what we feel like we really need. So that's why that drop of that. Non-discretionary expenses are up 144,374. Of highlight there, the county of Alameda had very large increases in its county council fees. They are doing huge hiring. So each department is taking a piece of that increase. And then an increase in our salary and benefits of 693,405. That reflects that we still have some project staff to hire to get lead settlement off and fully funded for a balanced budget of $8,397,430. And then just one final highlight, Director Hardy. Just wanted to highlight with you that is part of the work that we will continue to do for outreach and education, as we mentioned, coming out of COVID, that there's much more opportunities for in-person events. We recognize that during the pandemic, we leaned heavily on our email and social media, whatever, because that was all available to us, but it's already started that, I think in mainly, we have 5, 6 events, I think, something like that. I can't remember the number, but it's already ramped up quite a bit, and our increased engagement with our partners, they're letting us know to be out in the community talking to people. That is the number one way to get the message out. So that will be increased with all of our work here.
Okay, are there any further, first, is there any public comment on the budget?
There's no public comment?
Are there further comments or questions on the budget? Seeing none, thank you, April, so much for presenting that and for having a balanced budget for the agency. Is there a motion on the budget?
So moved.
Second.
Thank you. There's a motion by Guy and a second by Bella to approve the budget. Please call the roll.
Director Hardy? Hardy, aye. Director Miley? Director Bella?
Aye.
Bella, aye. Director Winrock? Director Gallo?
Aye.
Gallo, aye. Director Bowders?
Aye.
Bowders, aye.
Ayes have it. The motion is approved. The budget is approved for fiscal year 23-24. That will take us to item 6, which is the director's report. Director Brooks.
Thank you. June is National Healthy Homes Month, and the staff is planning a number of activities and events associated with that. And we'll report back to you at the June meeting on some of those activities and the results. We are also being blessed with the Deputy Director of HUD Office of Lead Hazard Control and Healthy Homes, Michelle Miller, will actually be coming out to visit with us next Wednesday to help us in terms of one of the events that we have planned. And so as part of that visit by Michelle Miller, we're also going to be taking her to Cypress Mandela to meet up with some of the folks there that are responsible for a lot of the trainings that occur within our community. And as you know, we partner with them in providing lead-related construction training. It just so happens that Eric Shanks, the director of Cypress Mandela, reached out to me yesterday and said, Larry, I really need you to come to Cypress Mandela. We're going to have some representatives from HUD, Section 3, which is the Employment Opportunities program. I need you there to talk about our partnership. And I told him how surprising that you should bring up HUD, because we're going to have the deputy director for the Office of Lead Hazard Control and Healthy Homes here with us. So let's just bring all these HUD folks together and let's talk. So that'll be the plan for next week, and I will report back to you all on that. The last thing that I'd like to talk to you about is management team decided.
One moment. Just 1 moment. Okay. We're in a public meeting. Thank you. Okay, go ahead.
Oh, thank you. Management team decided a while back that oftentimes we come and we talk to you about the challenges that we're facing, and we don't really spend much time on talking about the wins. And so I just wanted to share with you a few of our wins. Arthur Coulter, Kim Varner, and Timothy Lavender are healthy housing rehabilitation specialists who are working under the housing services section in the lead hazard control and minor home repair programs. Recently, all three of them received high praises from some of our residents here. Kim responded to an on-site lead consultation involving a rental property owner in Oakland, and the client said, actually reached out to us to tell us how, quote, how pleasant, helpful, patient, and thorough Kim was during the on-site consultation. Arthur Coulter responded to an unsafe renovation complaint and addressed concerns about dust left after renovations in a senior apartment in Oakland. And the client stated, I quote, the outstanding counsel assistance that Arthur gave to me, it was very, very helpful. You are fortunate to have a man of his knowledge, his service in talking to people and helping people. He is just the best. And then lastly, Timothy Lavender worked on a project in San Leandro involving a disabled senior in need of minor home repair. And that client contacted us and said, I quote, I appreciate the help that he's given me. I couldn't have done it without the program. A couple more wins I want to just throw in real quick is the win of April Williamson, as you just noted, providing us with a balanced budget. So that's definitely a win. And also Katie, who arrived here, I don't know, it's probably only been like 8 months ago from back east to take over as the head nurse over our public health nurses, to be the coordinator for our child lead poisoning prevention program, or CLIP as we refer to it. Also to manage the contract under the California Department of Public Health. And she has also been aiding the California County Health Officers Association in collecting that data that April mentioned that they're requesting in order to push back on the state Department of Public Health to provide all of the CLIPs with more money, since they're creating all these additional demands on us. So just outstanding for someone who's been here less than a year. So another great win. And then lastly, I do have to throw in at least one challenge before ending the director's report. As you all predicted last month, Senate Bill 356, the Code Enforcement Incentive Grant, did die in the Appropriations Committee last Thursday. There will be attempts made to try to resurrect it in the future. We did get a lot of feedback that this was just a bad time with the state deficit. We did take your advice, we did try to look for other programs that had money that was basically guaranteed in order to try to tag on. That didn't work. There's still some hope that maybe later in the legislative session that there might be some bills that are gutted that have some appropriations tied to them and that we might be able to slip the language in again. But in all likelihood, we will probably have to bring that legislation back in some future years. But I think it's really important that we do that because a lot of the code enforcement programs are saying they need that money in order to do what we're doing in terms of providing minor home repairs to rental units and also to provide some relocation assistance to tenants. So that's it for the director's report.
Okay, thank you. Are there any public comments on the director's report?
No public comment?
Okay, is there any questions or comments from directors? Thank you for the director's report. That will take us to item 7, the monthly report.
No comments for the monthly report?
Is there a monthly report presentation or just if we have comments?
We don't.
Okay, is there any questions or comments on the monthly report? Okay, that takes us to item 8, future agenda items. Is there any future agenda item requests from members? No, I don't see any. Before I move on, just confirm everybody can make the June meeting. Yes, June 22nd is our meeting, is that correct?
I don't have the exact date. Just
Yeah, June 22nd, yes.
Same day as
Same,
the-
yeah, same as here, I just want to make sure. Okay. All right, so there's no future agenda items. Are there any announcements by directors? Just say that made us bike, let's get on your bike. And so with that, the time is 10:42 and this meeting is adjourned.
Thank you.
Thank you.
And, Mary, you want to get a picture?